what Frontline does and who do you do it for?
Frontline Care Solutions was born out of myself, my wife, a couple of colleagues that really had that passion about teaching and educating people in the right space. So people, clinicians, care workers at any level, regardless of the level. A lot of the work is done on the front line in care, at the bedside, in the room, in the house, in the hospital, in the home. Frontline Care Solutions used to actually have a name of Frontline Aged Care Solutions. But as the society has changed and the healthcare system's changed, we now group disabilities, aged care and community services all into the one health domain because it's a cohort of people now that is quite diverse. So Frontline changed its name from Frontline Aged Care Solutions to Frontline Care Solutions, so that Frontline itself could diversify and provide this information to people who work in aged care, people who work in community care, people who work in disabilities, and people who work in mental health. All courses and workshops and seminars that clinicians and carers and people can attend and be given it in a format that makes sense, easy to understand and absorb, and they can take it back to work and take it into their care spaces and use it. And so over a small period of time, Frontline became very popular. And as Frontline started to get more popular, it moved into the digital space where Frontline started to record and to the information from the experts and make resources that people could get online. So as we moved more online, Frontline went more online. And now people on the front line in care can get access to Frontline's information, materials, training and resources, policies, procedures, how to run things, manage things, best practice ideas, things like that. Through the internet, download them and use it themselves. So it's more or less a business that focuses on the front line of care, focuses wholly in consultation, education and developing people's skills and allowing a space for not only care workers, family carers, but also qualified clinicians at all different levels of knowledge to enhance, continually practice and get better skills at what they do. And to know that the stuff we're teaching them is evidence-based and it is real.
Is there a lot of stuff there, Drew, for compliance?
Part of the Frontline business, because when you work in institutional care, is Frontline has a particular focus where it looks at compliance of the care workers who are not regulated by law. They still have to have skill. And the compliance of what an institution or organisation has to meet to the government law. So this can be very complex and broken systems. So Frontline, a part of its team, spends a lot of time looking at people, their skills, their competencies, their compliance to meet the legislation's accreditations and the needs to be getting a tick in the box as an accredited service, a service that consumers can value. And so Frontline, part of Frontlines is they develop the learning and education of compliance to standards for teams, and the compliance for policies, procedures, transactional frameworks, flowcharts, forms and tools for organisations to hold themselves accountable to be accredited by so they can do their job well.
And Drew, they're services that get sold to individuals and to institutions?
Yeah, so Frontline focuses its business in three areas. So Frontline has a mission and a value statement. It says best outcome for the client, which is the patient or the person in care. Best outcome from the care workforce, that's nurses and carers and family carers. And best outcome for the organisation. So everything that Frontline does, produces and makes must have those three elements met. So if they design or make something, it can be given to the consumer to understand, and they understand it. It can be given as a best outcome of knowledge and practice for the workers, and it can be given to the organisation. So Frontline more or less streams its business towards information education for consumers, information education for carers and paid carers and unpaid carers, and information and processes and things for organisations that want to wrap themselves around and support those people.
And what about professional accreditation? Can Frontline help with professional accreditation, and particularly I have in mind the points system, the CPD points?
Yep, sure. So Frontline aligns itself with a number of institutes, but like things like the College of Nursing, the Australian Counselling Association, and a few of the other institutes, the Australasian College of Care Leadership Management. But what it does is particularly is and the Royal Australian College of General Practitioners. What it is Frontline, then their staff and their people learns those systems of accreditation in those businesses, and then they get Frontline gets accredited to be able to write its material to the standards of those organisations. So those peak bodies or organisations that govern everybody or set a standard for everybody, the Frontline system meets those standards in everything they create. So Frontline has that little tick in the box that says the materials we offer you are accredited by those organisations, and we can give you a point for every hour you're learning. And when they audit you to hold your registrations and your credibility, our teaching adds up to those points. So if a person needs 100 points a year, 50 of their points could be 2 or 3 of our courses, or 6 hours in a seminar could be 6 points for them. Mm-hmm. So they value the fact that Frontline works in the background to make sure the information and the time that a consumer or a client or a customer or a student uses has got value to what we offer. There's an outcome to what they get. They're not doing it for nothing.